Time now for our Your Money segment, and we're going to look at healthcare for retirees. Stephanie Asymkoks is here to break down the best and worst states for healthcare if you are in your retirement. So Stephanie, break this all down for us. What are the best and worst states?
Sure. So Medicare access and quality largely depends on where you live. So some states provide a higher level of access. And then, we're a forced ranking of 50 states plus DC. So there are those on the bottom. And healthcare should be a key consideration for retirement, especially if your plans include a relocation. So there's definitely more to retirement and picking a location than committing to beautiful weather and low income taxes.
So Stephanie, where did the states rank?
So it turns out that 4 of the top 10 states ranked were in the Midwest. And Minnesota comes in at number 1 and takes the cake for best average monthly insurance premium and heart disease mortality. And then rounding out that top 10 were North Dakota, Nebraska, Iowa, all in the heartland, and then Massachusetts, California, Hawaii, Montana, Colorado, Connecticut. And then on the other hand, were states like Oklahoma, which came in last. Also Georgia, Washington, D.C., Mississippi, and Louisiana. They came at the bottom for expensive healthcare relative to quality and access.
Were any of the findings surprising to you, Stephanie, for this rankings?
Sure. So my source wasn't at all surprised by how these states shook out. And that's because the writing has been on the wall for quite some time if you knew where to look. And for the states that have historically invested in programs like healthcare, education, their healthcare networks were among the country's most robust. And then on the other hand, those at the bottom were more likely to display poor healthcare systems and education funding, plus nutrition-related issues. So there's definitely a cause and effect relationship here when we talk about the best outcomes for people.
And finally, Stephanie, how do state taxes and spending habits play into this overall issue?
So it just depends on how much of what percentage of the state's taxes get allocated to things like healthcare, education, nutrition, sort of those social services programs. The states that pay the highest percentage definitely had better programs, and the states that paid lower percentages definitely shook out more towards the middle and the bottom.
All right, Stephanie Asymkoks with that important information. If you are in retirement or nearing retirement, thanks so much, Stephanie.